Great. All right. Okay. Great. So today I'm going to focus on occupational cancer in Malaysia. It's basically just to talk about what we have done and also what is the current situation of occupational cancer in Malaysia. And next, please. All right. So I'm Professor Dr. Victor Hoe from the Department of Social Planning Medicine, Faculty of Medicine, University of Malaya. So currently I'm the head of the department actually. So this is a picture of me actually in one of the gypsum mine in Italy. Right. So I am a professor and also doing a lot in occupational safety and health. So we do go to all these things and look at it from that perspective. Next, please. So occupational cancer, of course. I think today everybody knows what's cancer. You're here because we are in a cancer conference anyway. But we talk about occupational cancer, is basically cancer that is due to exposure to hazard at the workplace. And when we talk about hazard at the workplace, what's the first thing you have in your mind when we talk about hazard in the workplace? Sorry? Yeah, it's a carcinogen, all right? So it's a carcinogenic hazard in the workplace. The first thing is that it is preventable, all right? You don't work, then you don't have cancer, correct?
Yeah.
So it's simple. So you don't work, you don't have cancer, so it's preventable. So that's why it's important for us to understand the hazard at the workplace, so they prevent from people getting exposed to those hazards. I think is important. And of course, I want to tell you and other things related to that. All right. Next, please. Of course, I think everybody knows what's POT, all right? Percival POT. I mean, those that do medical will remember who's Percival POT and how he actually identified occupational cancer or scrotal cancer to start with. All right, so he has two diseases to his name. One is TB and the other one is scrotal cancer. So scrotal cancer is what he's famous for. Basically, he identified people especially boys, working in these chimney sweepers actually have scrotal cancer due to exposure to the soot, which is basically polycyclic hydrocarbons. All right. Next, please. So let us start with how to focus on occupation-related injuries and diseases, and then we go. So the important thing is when we talk about occupation is some disease should be preventable and it should not be there because we can actually start to improve on the workplace. So prevention is better than treatment and cure. So the rising problem of economic losses affect for first foremost. So every year, 2.78 million people die each year through work-related accidents and diseases. So injuries is only 380,000. Most of them died from work-related diseases. So it's important for us to identify them. Next, please. So work-related death in 2019. All right. So if we look at that, malignant neoplasm is basically one of the higher death. Of course, the first is circular disease, and then other injuries. But malignant neoplasm is there. Next, please. All right. This is for in the Western Pacific region. So work-related death in the Western Pacific region. So can you please your head? You're actually blocking the notes. Can you lower down the slide so that you can don't block the notes? Yeah.
Oh.
Right. Thank you very much. So 810,000 work-related deaths occurred in 2019. All right, next please. And in the what kind of death actually talking about is most of it is lung cancer. All right, so lung cancer is the malignant neoplasm that is this is basically occupational related. This is not normal lung, this is occupational related. So most of them are lung cancer. Next please. All right. And this is about men and women. So there's the men and women. So at the end is basically it's still lung cancer have been removed, but men and women. Next please. All right. So this is among men. So 75% of the cases are actually lung related. So lung cancer. All right. Which we will discuss with you why it's the causes of most of the lung cancer. All right. Then the other cancers, stomach cancer, esophageal cancer, bladder cancer. Next, please. And of course, and this is the same thing among women, all right, except for breast cancer. All right, this is breast cancer related to occupation. This is not. This means it's preventable. This is occupational hazard breast cancer, and this is breast cancer And this is what you also lung cancer. All right, next please. So this is, that one is the talking about one studies, and this is looking at it from another study itself on systematic analysis of global burden of disease study on global regional burden of cancer in 2000 arising from occupation exposure of selected carcinogen. So they look at selected carcinogen, and we tell you what kind of carcinogen is important when talking about occupational cancer. Next please. All right. So they look at 14 IRC group 1 occupational carcinogen. Estimated was done using population attributable risk, then exposure using CAREX. CAREX is basically a method of basically looking at what is the workplace and how much in the workplace actually contribute to the exposure. So CAREX, that is a way of looking at it. So we are going to explain another method later. Next please. All right, so they look at 8 primary cancer sites: breast, kidney, trachea, larynx, leukemia, mesothelioma, esophageal, ovarian cancer. Next please. All right. So most of the cancer death basically from occupation is men, which 79%, right, and 21% is among females, right, from cancer-related death in the workplace. That means from exposure to occupational cancer, occupational hazard. Next please. And talking about cancer death is basically lung cancer, 86%, mesothelioma, and larynx. So the other, there's a small amount for small cancer. So different study have different outcome, but focus is just still, most of it is on lung cancer, all right, and mesothelioma. And even for disability adjusted life year is basically the same. Basically, people lost life years due to lung cancer and mesothelioma and laryngeal cancer. Next. This is why lung cancer is the most important component. If you look at it, it's asbestos. Correct. So asbestos is one of the major occupational hazard that leads to lung cancer, and that's why we are in the process of elimination of asbestos use, especially because we have actually eliminated some type of asbestos, but we still need to eliminate all type of asbestos. So asbestos is one of the main problem. Of course, the other one is secondhand smoke, correct? And we have not been able to do that in the last in our what we call that revision to the Anti-Smoking Act, which is basically or the introduction of the Smoking Act, which is important. So secondhand smoke is the one. Then silica. So silica dust or silicon dust is present in the workplace. So these are the main risk factor. But the last is basically diesel exhaust. So diesel engine exhaust. Basically, this is one of the factors also involved. These are globally or regionally. That's what they're looking at: asbestos, secondhand smoke, silica, and diesel engine. The rest of the chemical we're looking at is arsenic, benzene, beryllium, cadmium, formaldehyde, nickel, PAH, strong inorganic acid, and trichloroethane. So these are also chemicals that actually can cause cancer, a hazard that can cause cancer or occupational cancer. Right, next please. So common cancer primary site is lung, all right, and is due to asbestos, silica, secondhand smoke, and diesel exhaust. And also larynx, asbestos, strong inorganic acid. So the main thing is asbestos is the main culprit in causing cancer, especially occupational cancer. Next. So there are the main thing is that we have been trying to control asbestos, and there is a movement globally on elimination of asbestos in the workplace, or elimination of asbestos in the country, not in the workplace. That means we stop using asbestos at all. All right. And of course, secondhand smoke, silica, and diesel exhaust. That secondhand smoke can be done. Silica is we can actually eliminate it or reduce it. Diesel exhaust smoke also we can do it. So all these things are basically preventable. And there's a main point that you need to take back today is that occupational cancer is preventable, and if you identify the hazard and control the hazard, you can prevent it. Next, please. So now we could come back to Malaysia. So you have looked at it from the regional, you look at it from the global perspective. What do you think Malaysia has? What is the problem in Malaysia? What is the statistic of how we look at it from our own area. Most of you are from Malaysia, correct?
Yep.
Next, please. All right. These are the numbers. You look at it. Numbers. These are numbers. These are not in 1,000 or 10, 1,000. These are just single number.
Wow.
Which means it's very low. All right. This is from SOCSO, Social Security Organization. I mean, where's the problem? We don't know where the problem lies, or whether it's because of diagnosis or not, or other problem. Basically, we have not done any study on what is the real number of diseases, but we can identify our own. But these are numbers by our Social Security Organization, which is our organization that actually compensate people who's working from the non-government organization, which is most of the has work is in the private sector, and this is basically between 18 and 1 or per year, so it's very very low. Next, please. So this is this is even worse. This is basically this was notification to this was compensation. All right, this is notification to DOSH, Department of Occupational Safety and Health, over from 2011 to 2019. There's only 7 cases notified. So, and the only 7 cases, only 3 cases we know what's happening. Nasopharyngeal carcinoma, aircraft engineer technician, and acute myeloid leukemia, car polish worker. So the numbers actually, we need to improve on the numbers lah, and that basically we need the help, not the occupational physician, but the physician out there who is seeing patient cancer. Why you need to consider workplace as a main cause of cancer, because it's important for me to identify the numbers. Next, please. All right. So, what are the occupational exposure carcinogen agent among manufacturing employees in Malaysia? We done this research. All right. Next. All right. So we use what we call OP ideas. OP ideas is a specific for task for job based on expert experience, knowledge, and employees' job history. Assessment is more transparent and consistent manner, time-saving, contains job-specific modules interlinked with fragment list and 38 priority carcinogen. So it's basically applied by Safe Work Australia. So this is all ideas is basically an idea, a system developed in Australia. Next, please. So example of job-specific module is basically, did you chop down trees? How do you usually chop down trees? If yes, then probable exposure. If chainsaw, high level, handsaw, medium level. So why is it important? Okay, this question is basically whether you are exposed to wood dust or not. All right. So wood dust is another form of carcinogen. All right. If you breathe wood dust, it's a form of carcinogen. Hardwood dust is worse than softwood dust. That means the wood dust that we have in Malaysia is hardwood dust. All right. Next, please. But we did not look at that. So these are the list of carcinogen that we look at in the what do you call that industry. Next. All right, and these are the job-specific module that is available inside the OP ideas. Next. All right, and these are the task module. That means what you do: asbestos removal, back burning. That means all these things we understand. By example, if you do asbestos removal, we know your risk, we know your exposure, we know how much exposure is it, and how long you work. Then we can calculate your risk of exposure. All right, next, please. And this is how we did the study. Basically, we use the web base, and then after that we just ask the workers, and then we estimate, and we come up with the estimated outcome. Next, please. So we sampled, selected is 129, excluded 86. Then eligible respondent, refused, and non-responsive. So finally, we get only 501 samples. All right, next. And prevalence of exposure to carcinogen agent among manufacturing workers. Exposed to at least one carcinogen is 76%. Exposed to at least one carcinogen, excluding environmental tobacco smoke, is 67.9%. So most of them is exposed to diesel exhaust, diesel engine exhaust, environmental tobacco smoke, benzene and styrene. Alright, so those are the hazards that's exposed to among the workers that we work. So there's increased odds of occupational exposure to carcinogen among manufacturing worker. If you are a smoker, ex-smoker, your cost is increased. Technician is increased, and then construction worker also is increased to 4%. Just an odd ratio of 4.0, the increased odds of next please. So this is where we come to why the low numbers. But this is not just one of it, basically why the low numbers, but I have also some other things that we can talk about next please. Alright. So basically survey of doctors of occupational disease and 168 encountered patient with non-work-related disease, encountered patient with suspected cancer, non-occupational, notified occupational cancer. So they did, but alright, next please. And most of them basically, if you look at it, cancer is only the lowest. Most of the disease that we find in the workplace is basically work-related musculoskeletal disorder, and there's the highest number if you look at SOCSO claim over the years. Work-related musculoskeletal disorder is the highest number. Noise-induced hearing loss is also the highest number of notified disease to DOSH, so it's different. So noise-induced hearing loss is the highest number notified to DOSH, and work-related musculoskeletal disorder, the highest number compensated by SOCSO. Next. Alright. So barriers in notification of occupational cancer. Vast amount of new hazard. Alright. Barriers in recognition of occupational hazard workplace, barrier in recognition of occupational as an occupational cause of cancer, financial disincentive to report occupational cancer. There was financial disincentive previously, but with the new Occupational Safety and Health Act, which comes into effect on June 1st, 2024, there is protection for doctors to actually report occupational diseases, occupational cases. It's protected under the Act. And if the doctor don't report, the doctor can be fined up to 100,000 for not doing his work. So can be fined for 100,000 and he's protected under that. So that's why there's a financial and barrier in medical practitioner participation. That is the main point we want to talk about. So all these things are the factors that actually relate to occupational low numbers of occupational cancer. Next, please. All right. So factors associated with knowledge of identifying occupational cancer. Most of the time is basically the lower knowledge is because they have not been trained. All right. Our training itself actually does not provide you with knowledge. The thing you must understand, how many of you here are respiratory physician? Anyone of you here is respiratory physician? Or do you want to say? All right. Any physician? Doctors? No doctors at all. Got doctors. Right. Okay, I got doctors. Good. All right. So when I talk to respiratory physician, why they don't report a suspect cancer? Because the thing is the management going to be different between occupational and non-occupational cancer from the management perspective? No, correct? Okay, no. And once they ask the worker smoking, then they will stop. Smoking is the cause of cancer. Full stop. The rest of it is not important. Right? So that is why there's some of the things that we find out. So next, please. Alright, so thank you very much. Thank you for your time. My time teacher say 1 minute.